Hello, I am Dr. Saumitra, a cardiologist practicing at the Manipal hospitals in Kolkata. Today I'll talk about the ambulatory blood pressure monitoring and its importance. ABPM or ambulatory blood pressure monitoring provides a 24 hours account of the patient's state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and masked hypertension. It is accurate in predicting the risk of cardiovascular disease and mortality. Blood pressure level measurement using home or ABPM is recommended in patients with office blood pressure classified as high normal or grade 1 hypertension. ABPM provides the average of blood pressure reading over a defined period, and that is usually 24 hours. The device is typically programmed to record blood pressure at 15 to 13 minutes interval, and average blood pressure values are usually provided for daytime, nighttime, and 24 hours average. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable blood pressure recordings are required for a valid ABPM measurement session. ABPM values are on average lower than the office blood pressure values, and the diagnostic threshold for hypertension is 130/80 millimeter of mercury or above over a 24 hours average, 135/85 millimeter of mercury for the daytime average, and 120/70 millimeter of mercury for the nighttime average. And they all correspond to the office blood pressure above 140/90 millimeter mercury. The advantages of doing ABPM are several. Better predictor of hypertension-mediated organ damage than the office blood pressure. An ABPM mean has consistently been shown to have a closer relationship with morbid or fatal events. More sensitive risk predictor than the office blood pressure for cardiovascular outcomes such as coronary morbidity or fatality or stroke. Can identify white coat and masked hypertension. It is a stronger prognostic evidence than office blood pressure. We get nighttime readings and measurement is in real life setting. There is additional prognostic blood pressure phenotypes we can find out, and abundant information from a single measurement session, including short-term blood pressure variability. But there are certain flip sides, like it is expensive and sometimes not so easily available, and it may be uncomfortable, particularly while disturbing sleep at night. ABPM has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from the European Society of Cardiology recommend that diagnosis of hypertension should be based on repeated office blood pressure measurement or ABPM if economically feasible. Analysis of various indices on the ABPM graph, such as hyperbaric index, diurnal index, dipping, and other indices, can provide useful information about the prognosis of disease such as hypertension, diabetes mellitus, chronic kidney disease, and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ABPM is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help direct the treatment in such patients when required. Overall, ABPM readings can guide towards the prognosis of underlying organ damage and can be a very useful predictor of cardiovascular risk. Thank you.